Has your doctor told you that a hysterectomy is your only option to end your fibroid suffering for advanced fibroid disease? Do you want children? Can you get pregnant with fibroids? What are the risks? Can you still have a baby after fibroid surgery? These are the questions that Black women wrestle with, because up to 90% of us are affected by fibroids during our childbearing years up to age 50. So tonight, I'm being joined by one of my favorite guests, my physician partner, Dr. P, to tackle this discussion, the truth about Black women, fibroids, and pregnancy. So stop what you're doing, invite your friends. Again, up to 90% of us are battling fibroids, and that means that we have more risks, more symptoms that can affect our fertility, our quality of life, our overall general health. And we have more complications to navigate around, but we have more solutions than we're being told. So let's get into it. First, let me welcome you to Detox Living, where we bring you tips, truths, and testimonials to power your toxic-free living. I'm your host, Coach Gessie, fibroid survivor turned health activist and founder of thedetoxnow.com, a holistic health provider of education and supplements to help combat obesity, chronic disease, reproductive health issues, and more that lead to lower life expectancy rates. I'm going to bring on my guest. Hey.
Hello.
Hello, my friend.
How are you?
I'm great.
Awesome.
I am great. I'm great. I don't know if, well, first of all, as I often do, I want you all to check out Pulse of Perseverance, Pulse P3. I call it P3 because that's the thing I remember all the time. But you're doing a major fundraiser right now around your charity. So plug that real quick, because I'm one of the sponsors. The Detox Now is one of the sponsors. We're excited.
Appreciate that. So Pulse of Perseverance is my other life. It is a nonprofit organization aimed at changing the narrative, shifting the culture for Black youth. We talk about, healthcare disparities, and healthcare disparities, they transcend to every form, like legal disparities, disparities in housing. Everything is because of lack of representation, and a lack of representation stems from access and the availability of mentorship, which is why we're underpopulated in every, facet, from law to engineering to medicine, which is why bad things happen to us. So my organization, Pulse of Perseverance, P3, is that book in the back of me. Me and two of my brothers, we wrote a book about 6 years ago.
Shout out to these Black men.
Appreciate it. And we wrote a book documenting the stories of our lives as Black men trying to attain a level of success that wasn't really afforded to us. And we did that. We wrote about that, hit some major platforms, but from that, we funded scholarships, and more importantly, we're addressing the need that we see as the biggest problem, for our communities and our people. And that's really mentorship and access. So P3 will be launching on May the 16th.
That's an app, right?
It's an app. It is the first mobile mentoring application of its kind, to where now kids will have a IG Live and IG, a LinkedIn for mentorship, to where they can go and then they can follow mentors that are in specialties that they don't even know exist. So even kids that just, want to play professional sports, we have, professional athletes that are now entrepreneurs that will be on the app where they can follow them, ask questions, and follow them as mentors. So now we can guide their pathways into these levels of success and change the tide of,
Change the
these low numbers that are in here. So ending healthcare disparities and those things. Because when you walk in and you see a doctor that looks like you, now the chances of them taking care of you like you need to be taken care of are exponentially higher.
I love this.
And it's not just medicine. It's everything.
Not.
It's everything in there. So
I love this because if you can see it, you can be it. It's a saying we've all heard, but the truth is, if you can't even see, you have no representation of yourself in this work. It's not even in your realm of possibility, right? And then it's, if you can see it, you can be, but then if you can touch it, you can actually become it, right? Because if you have no access to help the champion you, to help provide connection, right? To provide access, like that is a huge piece to reality. It's simply that. So I think about it as, now there's platforms that allow for talk therapy, right? Where you can be in touch with therapists through mobile means now. Yeah. Well, this is now creating a system and a network for you to actually, as youth, reach into, wait a minute, what's possible for me in ways, in places that I don't have access to in my daily life, right? I don't have access to in my personal network.
And so the app is like, I got to brag on it. It's super dope. It doesn't just do, give the mentor. It really like dives into the minds of these kids, sort of like, like a Apple Music, Spotify, where it's asking you like, what's your genre, what type of artist you like. It's asking them, trying to figure out who they are, so that they can actually figure out what they want. Because if you ask, 9 times out of 10, you ask a kid, that's 15, 16 years old, like, what do you want to do? It's like, I don't know, I'm trying to figure it out or whatever. But if you can actually jump into their mind and kind of see what they like and show them all of the options.
Right. The discovery. It's like you open up the discovery.
It's called an explore page, where they explore all of these different things, and they, can see what those things are. And then it just has mentors behind all of those things. So even if they say they want to be a basketball player, right, they tap on the basketball button and it flips over and it shows, entrepreneurship, managers, sports agents, all
different things that they can do in that industry, in that arena. Well, number one, I'm signing up to be a mentor.
Absolutely. You got to. You have to.
Of course, but the other thing is that, there's so many things that just because you've never even seen it as a possibility, it's like, you don't even think, oh, wait a minute, there's in medicine, it's not just operating. I could be a radiologist, right? I could be I could be the person who does that. In the arts, I could be the manager, or, I can be the person who actually designs the set design. Like again, I love it. I love it. I love it. I can't big it up enough. And I just wanted to start off with that real positive note.
May the 16th is the fundraisers in Chicago. Like, if you are in the area or if you want to fly in, we're going to kick it. It's going to be silent auctions, food. And it's going to be,
you can sponsor somebody else's ticket.
Absolutely.
Like, if you can't be there.
So, donate. We'd love to have you guys there. So check out www.pulseofp3.org. And love to see you guys. Just jump on board, even if you can't be in, like, donate, support, give us your love. Like, we cannot, be the change if we're not putting the effort into being this. We can't complain about it. Like, you have to actually be the change.
Well, we can't complain about it, but we got to make changes at the same time.
If you want to actually see something done about it, you actually have to put the work in to do it. We can complain all day long.
Absolutely. So again, the reason I'm so excited about our partnership is because we get to break down, dismiss, bust myths around, things that our communities are ignorant about, don't even know solutions. They don't even know they have access to, right? Mm-hmm. So this is, in a way, also, this is changing that narrative, because there are things that, we only think one way because it's all we've ever been told, right? And so, I don't know if you're familiar with Deion Sanders' daughter, Deandra Sanders.
Yes.
She announced her pregnancy, weeks ago, and I posted
is it Jackie? She's still with Jackie? I'm out of the loop.
I have seen. I'm not talking about the boyfriend because
Okay,
I have seen
it's
that is,
supposed to be Jackie. I
yeah,
mean, that's what I saw.
it
I don't know.
is. And I, from
I'm
my
off the loop.
understanding, she and
I'm a
I did not
layman now.
discuss that, but she was she,
So,
bottom line is, again, social media can be used for a powerful good. I reached out to her, I posted about her
yeah,
and just, just number one, wanted to encourage her that she's not alone. And that, my personal story,
yeah,
she's pregnant with 7 fibroids,
sure.
it tugged at my heart because I have fibroids that were literally siphoning the blood supply away from my baby after 3 myomectomies,
Hmm.
five IVF cycles, right? So here I was being told to consider terminating my pregnancy because it would become a hostile environment for me and my baby. And, and thank God that I didn't listen to that because my baby's on Broadway right now doing her thing. All right.
We in the
Literally
money.
right now. Yes, Nia, go Nia.
Go
So,
near.
but when I saw her story, my heart was just like, it just went out to her. And I just posted, she commented, and I was like, look, I'm here
So
for you. So she reached out. We went on, we did a coaching session, on FaceTime and just, supporting her with supplementation to help balance her hormones and nutrition to help, to really do what she can to inhibit any growth of fibroid in terms of her whatever stress factors, things that she
sure,
can do, right?
sure,
Obviously there are things that are outside of her control, but there are things that does have control around,
sure.
and that's what we're focusing on, right?
Yeah.
And it brought up just the whole conversation that that women deal with all the time. And I wanted to just to go through those questions. I said them at the top of but like, number one, how many women tell them that hysterectomy is the only and vertical incision on top of that, hysterectomy is the only option available to them, right, for to end their advanced fibroid disease, right? So I want to address that, but I first want to define advanced fibroid disease because we say it a lot, and I wonder if people, just want to
Sure.
give them some parameters.
So advanced fibroid disease doesn't really have a true Webster definition. My personal definition
Yes.
of what advanced fibroid disease as a fibroid specialist is multiple fibroids that are at least 10 centimeters or greater,
Mm-hmm.
and or numerous fibroids that cause the uterus to be larger than the umbilicus or the belly button.
Mm-hmm.
Right. So
So
that's pretty much
above the belly button.
above the
Mm-hmm.
either at the belly button or above.
Mm-hmm.
So that's my personal definition, either one or both of those criteria.
Okay.
But to that end, you can also add in patients that have, numerous fibroids and fibroids that are significantly pushing into the cavity of the uterus.
Yes.
So they can even have small
Yeah.
fibroids
And
and they're pushing into the cavity of the uterus. And I think that's advanced as well. But to that point, it's like the women who are truly fall into that category have just the visual characteristics of it. Like you could press your belly and it's hard. You can look
right.
at them and people are calling them
Right.
pregnant or what have you. That's
Right.
a rare group or a smaller group. It's not rare. It's a smaller
Not
group or
rare. Yeah.
small
The
subset of
subset.
women
Mm-hmm.
that are in a category that makes doctors uncomfortable for them to operate on them and to
Right.
provide them options.
So before we go into the solution, would you also say that advanced fibroid disease could look like very small fibroids, but they are, let's say, inside the cavity or sub mucosal, and they're causing hemorrhaging that is life threatening, right? So it could not be physically perceptible, right? Because they're internal, they're not necessarily big, but that could also. So maybe it's really any fibroids that debilitates your ability to have health, right? Your quality of health, right? So probably more cases are what you talked about, but I do know that some people may have small, but location. If it's in a place where it's causing hemorrhaging, right? To the point where they are, not able to sustain any kind of a healthy blood count. Severe anemia can cause heart failure. It can result in heart failure. other things like that.
The
So,
only reason I don't put that is in one of the advanced buckets is because I differentiate the advanced women because they're in a group of people that have just such a limited amount of providers that are comfortable with that
okay, you're
situation.
saying that because doctors would not be comfortable with the surgery outside of a vertical or very,
Correct.
very invasive procedure such as hysterectomy.
Correct.
Got it. Okay.
Correct.
So that makes perfect sense.
Yeah.
So you can have, right. So we got that definition. Yeah. So now, as you said, it's a matter of how many providers are actually able, skilled to do those surgeries. Well, because so many women are told the only option for you is hysterectomy, right? And we talked about a case that was that I shared about recently, and you know, unfortunately, we both looked at it and we're like, man, that uterus is when you look at the cases, it could have been done laparoscopically, right? Talk to us about that, because you've removed, you know, we have cases where we talked about where 100 and something fibroids through a horizontal small laparoscopic incision. Like, the numbers don't lie. So let's talk about that.
So there's definition why. So when you say laparoscopic, they're thinking like small. So laparoscopic by definition is, yeah, I know what you mean. I know
transverse.
What you mean.
Yes.
No, I'm not trying to correct you like
no,
that.
No.
I know what you mean,
right.
But if you say something like people watch and they're like, Coach Gessie said laparoscopic, so I'm just correcting it. So, from a laparoscopic standpoint, laparoscopic, guys, means, you know, small incision where cameras getting placed in, and then all of the surgery is done within the belly through tools, not actual hand. Like the hands are controlling the tools, but it's on the inside.
And that was a procedure that you were like, that was small enough that could have been done laparoscopically.
Yeah. So from a laparoscopic standpoint, I am I've shied away from really doing those surgeries, even though I'm a laparoscopically trained surgeon. I'm a robotic trained surgeon. And the reason why I don't perform laparoscopic myomectomies is because, you know, two reasons, as I always talk about. Number one, the success of fibroid surgery and preserving a uterus is removing all of the fibroids. One, if you cannot see it, then it's going to stay. So from a laparoscopic standpoint, you can only get the ones that you see. So if you have a pea-sized fibroid, just think about a pea being in a, what's those big steaks? Not the T-bones, but the huge steak.
I'm vegan, so I don't know.
I know, but the big ones, the big brontosaurus steaks. Anyway, the biggest steak the biggest steak. I don't know why I'm blanking on the name of that damn steak. But if you think
anybody out there, help them out.
I can't recall it, but like,
are you talking about like the
tomahawk? There you go, tomahawk. She said it beautiful. So like in a tomahawk steak. So imagine a pea being in a tomahawk steak, right? Like if you look at it, you're not going to see that pea. So that pea is going to stay in the tomahawk. It's not going to be removed. Yeah, you're going to get the baseballs and the softballs out of the tomahawk, but you're not going to get the peas. So from a laparoscopic perspective, you can't get the peas and they stay. So that's why a lot of these repeat surgeries are happening, because the peas are being left behind. So that's number one why I don't.
But a laparoscopic, but a hysterectomy could be done laparoscopically.
All hysterectomies can be done hysterectomies.
And that's
so I
because you don't have
performed. Right. I have not in my now going on 11 years of practice, I have not performed one open hysterectomy. Every one of them is laparoscopic or robotic. Every single one.
I want y'all to understand that. So because that is really important, because I don't know how many women are told that in order to have a hysterectomy, they have to be opened vertically. If you're not even trying to specifically make sure you get all of the fibroids, and you're removing the uterus because that's your decision, and you know, we can support whatever your decision is for your body. Why? What are the reasons physicians say
for vertical incisions
or horizontal to open somebody up for a hysterectomy?
Well, number one, I mean, I was just having this conversation with the patient that I just had a virtual consultation with.
Mm-hmm.
Number one, the approach to surgery is supposed to be the safest for the patient, but when you say the safest for the patient, that also includes the comfort of the physician. So if
Mm-hmm.
the physician is not
That's true.
comfortable doing a particular procedure, then
Right.
now it becomes unsafe for the patient. So
Right.
it's much more comfortable for a surgeon to open you up with the biggest incision possible to be able to not struggle
Right.
and to do all of the work through an open incision. It's much, much more uncomfortable to do that same surgery through very, very small incisions, especially if you don't have the experience to do
Yeah.
that.
So if you don't
I
have, so it's more an issue of skill level. If you don't
it's
have
skill
this,
level. It is skill level, but it's also it's convenience. Like right now, like uh, I make these small incisions because I'm thinking about cosmetics. I'm thinking about recovery. I'm thinking
afterlife and
about pain.
recovery.
All of
Mm-hmm.
those things. I consider that. So I'm struggling on purpose. I am
Mm-hmm.
choosing to have a longer OR time, to have more of a struggle because I'm thinking about the patient. Would
Right.
it be easier to make a hip to hip and an up and down and be out in 2 hours and going to play with or going to deal with my kids or doing everything? Yes, it's much easier
Mm.
for me to do that,
Mm.
but it's about selflessness and putting, the patient or the person first. Everybody's not
And the
willing to
higher
do that.
risk and protecting the patient from higher risk of complications,
Absolutely.
right?
But they don't
Because,
think about that though.
yeah,
We're not thinking about that.
which is incredible, right? The more open you are, the higher the risk of potential surgical complications, infection,
Infection, bleeding.
long-term recovery issues, right?
Yeah.
Were you talking
Infection,
about?
bleeding, pain, all that stuff is all
So a
increased when you do that.
little insert there. I was in the ER recently. I had to go to the ER a couple of weeks ago because I woke up with severe pain on my left side. It was literally right underneath my rib. And I know, I have polycystic kidney disease. It's genetic kidney disease where you have hundreds of cysts, literally hundreds. You can't even count them all over your kidneys and sometimes over your liver. I have both, right? So because of this, when I tell you I couldn't breathe without sharp, piercing pain. Now, I preach, don't ignore pain, right?
Yeah.
So I was like, first, I just thought it was gas. So I was like, all right, let me just, see what goes on digestively. I passed gas, went to the bathroom, and the pain was not going anywhere. I text my nephrologist, which is your kidney doctor. I said, listen, this is what I'm going through. He said, you know what? Because of I have to manage this the rest of my life. Because of your surgical complications, we need you to go to the ER, right? Because we need to find out, it could be a bowel obstruction. It could be, right? Because of where it is, it could be a ruptured kidney cyst. It could be a kidney stone, right? It could also be a blood, like when I went there, when I tell you I was in the ER for 13 hours overnight because they tested me for blood clot. They tested me for stones. They did a CT, a pelvic CT. They did blood work and all of that. And it ended up being a ruptured kidney cyst with no infection. Okay. But because of everything I have been through, again, when I say to people, when you have had surgery that is that invasive, it follows you for the rest of your life, right? You have to consider these things, rule out these things for the rest of your life. Beautifully, I had no obstruction. I had no clot. I had a wonderful creatinine, and I have to say I'm a big up detox living right here because I had a creatinine of 1.6 that had actually even spiked because of some dehydration issues. It is down to 1.41 just because of lifestyle change. My doctor's like, I don't even know how you have this creatinine because of your family history and everything that's been going on with you. So I said all that to say that we need all the information. We need to listen to our bodies, and we need to make sure that the doctors that we're dealing with have a comfort level with the best option, long-term options for us. Okay. I say to people every day, somebody commented this week, they're like, man, Dr. P's consultation is this. I said, listen, I don't have nothing to do with his price, but I'm going to tell you this. I said, it is worth it. And if I had to get on the table tomorrow, that's where I would be. Okay. So do with that what you will. Okay. Because there is a value that is needed to be we need to associate with, become comfortable with when it comes to our bodies and long-term impact. Okay.
And to that, I would say literally today, I'll just look at my day today. So today, I had a patient that drove in from Florida, literally 20 plus hours for surgery, because she wasn't given the options in Florida. When I finished that surgery, I came home. I did a virtual consultation with a woman. Where's she from? She's from Baltimore. And in that consultation, it was her husband. I'm tired, albeit, but I spent an hour and 40 minutes answering every single question, everything she had, walking through everything and doing every single thing possible. And from there, he begins to tell me, it begins asking, very educated woman, advanced level degrees, and was asking, like, why am I always getting that I have to have a hysterectomy? 33 years old. I promise you,
33
years old. She said, I have to have a history. She has advanced fibroid disease, very large fibroids, has to have a hysterectomy. She was like, well, why? She asked the exact same question you just asked. Like, what is it about doctors that are saying that I have to have a vertical incision? Because I've heard that multiple times. You're the first person that says, I don't have to have a vertical incision. And I explained to her exactly what I'm telling you right now. I explained this to her and I answered those questions and walked those through. And to that point, she definitely is going to call me in for surgery. She's going to get put or whatever. But so everybody talks about like the price or whatever, such and such. I don't care what I have done for the day. These surgeries take me in excess of 6-7 hours. So
this is what I'm saying.
For an hour and a half, hour 40 minutes.
That's what I'm saying. You get what
it's just it's you're gonna get what you pay for.
I'm gonna toot your horn myself. You get what you pay for. Okay, you get what you pay for, and this is real, like for real. That after 7 hours of surgery, that you're gonna get that level of detail and attention, and to answer all your questions. And still, he's on this live right now with me now, giving out free information. So you know what? Write your check, dude. I don't
even argue about that.
No, and you shouldn't have to. Keep it next, but I'm gonna let him know every time. I'm gonna let him know. Okay. Yeah. All right. Next question. Okay. So I
got my patients in here now.
I know they're like, he is worth it. I saw all caps. This is why. So just to recap, if you're being told that you have decided that you want a hysterectomy, because everybody's decision is, do you need one? That's not what's on the table. The question is that you've decided you want one. You decided you want one. You do not have to be open to have one. You can have one laparoscopically, which is through robotic surgery, right? Which will minimize scarring, which will minimize recovery time and long-term future surgical complications, the potential for it. Okay. So that I need that to be clear. That's number one. Number two, if you have advanced fibroid disease, all right, where everyone is telling you that you have to have a hysterectomy, you have not spoken to the right doctor. Okay. Because I can tell you personally from clients I have referred who I am now coaching them on their post-op prevention. Like this is regular. This is what we do on a regular. Okay. People who have been told, like Danielle, who had a 20-pound fibroid, right? Found Dr. P because of our announced partnership and the stuff that I was, our IG live, right? True story. This is true story. She said herself. Sure. And said, she knew she had an advanced condition. She could not walk. She literally, it was so advanced that she had hydronephrosis, not just no. She had
pulmonary
effusion, which
even me in 10 plus years of doing that, that's the first time I've seen that.
You saw it. It was causing her lungs
to fill up with fluid.
And that means because of the fibroid pressing on her lungs, causing them to have to remove that fluid regular. It didn't just like you do it once and it's gone, because it continues building up through, what is that procedure called again?
Paracentesis.
Thank you. Where they're basically removing the liquid. Okay. That is life and death, darling. That is a severe situation. You need surgery, not yesterday. You need surgery today. You need it immediately. However, guess what? You want to make sure, and kudos to her, that she didn't just let somebody just butcher her.
I tell her every time I'm proud of her.
I'm so proud of Danielle.
I'm so very proud of her.
We are doing she is doing the work post-op, brother. We are getting it in, okay? Because she decided I'm not gonna settle. All right. I'm not going to settle because somebody tells me that's the only thing that's available to me. Because guess what? I heard Coach Gessie, I heard Dr. P ring the alarm that that's all that's available to me. And she had her uterus saved with a small horizontal incision. It's on both of our pages. And that is one case, probably the worst case you said you've ever seen in your career.
That is the most extensive,
most impressive. Case. Right? Most extensive. And yet her uterus was saved, right? Mm-hmm. And it was done with a small incision. So I don't care what they're telling you. Please get another opinion. Please book that consultation with Dr. P. Please, because there is more available to you. All right. That was all that was a lot around our first question. It was just a lot, but we hear it so much. And I am, but I can tell you, I had a client who could get on your schedule, and her insurance it just didn't work out. But she used the things that we talked about in our lives to turn around and guide her in getting the right surgery for her.
That's all it's about. Trust me, I got plenty. I'm not.
Oh, I know. And your schedule.
I'm not clamoring for new people. Like, it's like I really want people to realize, like, I am not like beating the drums for the women to come here. No. I just want the best for people.
Yes.
I'm overbooked. I'm overworked. So it's
we're working on that. We're working on that.
It's not that. So if you just say, hey, like, hey, I don't really want to go, so it's fine. I just want you to at least have the information.
Yes.
And just have the options. Yep. If you don't have the option wherever you're at, I'm here. Yep. Just be able to arm yourself with the knowledge that you need to ask intelligible questions to these surgeons. Like, you need to know what things to ask and what things to expect. And that's why bad things are happening, because we just don't have enough information to ask. Where's the lady from? Somewhere from Middle East. I was trying to get her here, but she just can't. It's just so many barriers for her to get here. So we've been going back and forth talking about the things that she needs to ask her doctor, like what needs to ask. And we've been going back and forth, and I'm perfectly happy to talk to anybody about like what you need to ask your doctor or whatever. If you can't get to me, like, these are the things to ask. So that you can be as comfortable and safe as possible.
Right.
You need to know that information.
Yeah. No, it's critical. So next question was, can you get pregnant with fibroids? So I'll say, hey, yes, I was pregnant with fibroids. I had complications. But as I mentioned at the top, I had my baby with all those complications, and she's great. We have helped so many women who I'll give you several cases. This is actually these are without surgery. And I know you have with surgery to share, right? So we had a woman named Sasha, and their miracle babies are on our baby wall at the detoxnow.com. If you just go to the detoxnow.com/babies, you can see their miracle babies. But Sasha tells her story how, she couldn't conceive. She did our fibroids program, and her cycles were better, all of that. She actually ended up conceiving. She even was still, and I know this is going to get you, Dr. P, but she was actually following the nutrition protocols, the supplements and everything. She was actually passing fibroid tissue. Now, I know you like, how is that possible? This is what I'm going to tell you. She actually went to her physician because she thought she was miscarrying. And she went to the hospital and they were like, no, your baby's fine. This is actually fibroid tissue. Now, I know you're like, how is that possible? But this is what she said. It happened throughout her pregnancy. She even had a calcified fibroid that was no longer painful.
And she passed it in her pregnancy?
Yeah.
Like during her pregnancy?
During her pregnancy.
I can see that. It can happen.
Yeah, during her pregnancy. And she has 3 beautiful babies. Yeah. You know, then there's a woman who had a calcium. This is actually Angela Yee's from Angela Yee's team. She's one of her business managers, Paris. She's shared hers. I'm not sharing the story of anybody who's not done an interview publicly or shared their testimonies. Paris, she has a beautiful baby who's turning 3, Luna, and she had a calcified fibroid that was causing her terrible pain, but she was pregnant. Like she didn't know she had a fibroid until after she was pregnant. And it wasn't anything large, but it was very, very painful. And all the doctors kept telling her was like, sorry, at least what's happening is that the baby and the fibroid are fighting and the baby's winning the battle because the baby is taking the blood supply away from the fibroid and the fibroid is basically shriveling up, right? Meaning it's dying, it's not getting its blood supply, and that's what's happening. And that's why it's getting calcified. She was in like such severe pain, she couldn't even walk, right? So we put her on our, hormonal balance and nutrition plan protocol. And by like 10 days, she was up great. She had a wonderful pregnancy, healthy baby. So can you get pregnant with fibroids? Yes. Can you have a good pregnancy with fibroids? Yes. Every case is not the same, right? Like, so let's talk about where there are, where there are risks. Because even in our client, Rochelle, she came on Breakfast Club with us. Her baby was with her in the studio. She had issues conceiving, all of that. But the fibroid grew. No. The fibroid, she had a large fibroid, but it didn't grow during pregnancy, which was insane. The baby grew. Yeah. Baby grew.
Default,
they should. But again, it was like very managed. Let's put it that way.
It can be absolutely managed.
Right. And then
and to that point,
healthy baby. But there are scenarios where that doesn't happen, right? Absolutely. So the question is, can you get pregnant with fibroids? Yes.
Yes.
What have you seen?
Absolutely. So you can most certainly get pregnant with fibroids. But, to the bigger point of, you definitely need to be extremely careful about comparisons, right? Because I see
every case is the same.
Compare all the time.
Every case is different.
This person went through this surgery. Just like right now, you can look at a patient that has had a hysterectomy from me robotically, and though they've had a hysterectomy, just like a woman that has had open vertical incision hysterectomy, had the same surgery at the end of the day, but their stories are 2 totally different accounts. One's been in the hospital for 4 days and has, been down for 6 weeks and hadn't been able to return to work. The other one can be in the hospital for less than 24 hours and back to work in a week. Their stories are completely different. So when you hear different stories, like, you have to understand there are multitudes of different variables that go into those stories. So never compare yourself. You have to look at your case specifically. So the answer to that question to me is, have I ever delivered any woman with fibroids? Absolutely 100% yes. Have I ever had a patient that has had fibroids and then, as I'm seeing them, gotten pregnant with fibroids? Absolutely 100% yes. But I've also had many women that have been trying for pregnancy for many years and have healthy eggs, healthy sperm, what have you, and fibroids are inhibiting
the pregnancy.
Right. So that 2 things can be true at the same
time.
That's
correct.
So understanding the nuances of that. And I also have had women that have had fibroids, gotten pregnant and had major complications during pregnancy, just from growth restriction, from early losses. Because you have to look at it this way too. Look at your uterus, and I always use this analogy like a house, right? If you have the uterus as a house, the space that you live in is very coveted. Like when you're in your room, the walls and everything is a particular space. If you have things pushing into where you live, like if a tree falls off, of a branch falls off a tree and falls through your roof and then comes into your room, now rain and everything else, your space is not there, what have you. Like that's the same way
A
with
lot of
fibroids.
damage
So
can happen.
absolutely. So if you have a fibroid that's pushing into the cavity or into the house of your uterus, as this developing life is growing, it has a placenta. That placenta attaches to the wall. So imagine the walls of your house. It attaches to the walls, and
Compromised, right.
and then it grows. It expands. So if it expands and then it expands to a point where that branch is there and it's trying to expand,
Yeah.
now you're going to have a placental problem. And if you have a placental problem, now you have a baby problem.
Right.
And that can impact your pregnancy to a point where baby cannot, depending on where that's at, either early loss or a preterm or premature baby, right? So things can happen. It can also happen to where you have a fibroid because naturally fibroids are going to grow larger during pregnancy because of the estrogen content. The estrogen in your body is going to exponentially get more abundant. That's what fibroids feed off of. So if you have a 6-7 centimeter fibroid before pregnancy, it's probably going to be 11, 12, 13 centimeter fibroid at some point during that pregnancy. And if you have multitudes of that, just imagine as a space issue, your belly is only so big. It can only accommodate so much. So if you have a 6-7 pound baby is growing in there, and now you have multiple 13, 14, 15 centimeter fibroids that are occupying the space of your abdomen, it can cause complications from that too. So just, these are different things that can happen, but never should be the things that bother me the most is when a doctor says, you can't get pregnant.
Right.
I never tell a patient that. I never, ever tell a patient that. I have multiple surgeries in which I've done myomectomies. I preserve the uterus. And in the back of my mind, I know that it's going to be very difficult for this woman to get pregnant, that there's a lot of damage. It's not my call to remove her uterus. It's my call to do what I say and restore it. And at the same token, I'm very honest with her and say, hey, this is probably going to be very difficult for you. You're probably going to want to look into some in vitro fertilization options because doing this naturally is going to be difficult. But I never say never because you always can, I'm not God. Doctors are not God. And you have to at least say, hey, it's unlikely, but it can happen. And that's the same way. Nobody should say, you cannot get pregnant with these fibroids, or you can't get, nobody should ever say that because you can, but it can also be that it's unlikely that it happens depending on how severe it is.
There are more risks, right? So, so two things, again, just to boil down what you said is that number one, every case is not the same. Just because someone else did it should inspire you that it's possible, but it doesn't mean that you shouldn't look at the context details of your case. Okay.
Facts.
That's number one, facts, right? So number two is, if you have like the growth restriction, that's what happened. The fibroids were, in my case, growing where they were taking the blood supply away from my baby and my baby was not growing. Right. So even though her gestation was 32 weeks, she was between 32 and 33 weeks. She was only born at 2.5 pounds. At 32, 33 weeks, like that's a good gestation.
That's small.
Right? That's really tiny to be 2.5 pounds in that gestation. So, but that's because she had growth restriction from the fibroids. So can it happen? We cannot say no, because there are many cases. Absolutely it can, right? Whether or not, what's the best scenario for you and the baby? Because we also have to think healthy baby, healthy mommy, right? We have to think about that. And there are cases where the fibroids are in the way, meaning they can prohibit the ability of the body, the actual, the sac to attach to the wall, right? Where they're in the way, the implantation. There's a problem where implantation can't occur if there are fibroids in the way, and that is where fibroids can cause infertility. And then there are situations where if there are fibroids, they can cause complications down the road, right? There are. However, when you look at the question is, can you? Yes, right? Meaning it's possible. It's about, what is the best scenario for you? Is it better in your scenario to remove the fibroids? Because like if someone says they're trying to conceive, I automatically say you want the best case scenario, then you might need to look at having surgery, because if you have, a more advanced surgery, I want you to consider it, right? Of course, at the end of the day, it's your decision, But if you're like, you know what, my timetable's short, I'm just trying to let's.
Said it. You just said it. If you and I have women of different spectrums. It's like I go back to the lady today. She's 33.
Mm-hmm.
She got a bit more time to play with.
Right.
I have women. Oh, they 43, 44. You don't have the time to play with that, mama.
We playing. Yeah. We pressing the gas. We put in all the bells and whistles.
Can it happen? Yes, but do you want to go to the roulette table with a $5 chip?
Right.
In the table, or are you trying to go in with multiple chips to do it? Like,
if you're trying to do IVF, do you want to spend all that money and not have the best?
You go put that $20,000 on there, and you just got this one chance. No, you want to go there with the best you possibly can.
Yeah,
you know? That's real talk.
Real talk. So the next question was, can you still have a baby after fibroid surgery? Now,
absolutely.
Over and over, right? So talk to us about, give us case studies of your case studies. Share.
You just saw one of my patients who ain't taking.
We're gonna do a post about her, so we'll keep you posted. But
so I had a patient
8 weeks, right? She's 38 weeks.
8 weeks. Mm-hmm. So she, at the end of my last practice, like I was really out of there. I really didn't even have a practice when I operated on her, but I had been talking to her for damn near a year, and she went through hell and high water to have surgery with me. She like changed her insurances. She just went above and beyond, and she was actually one of the cases that made me leave that practice.
Wow.
Because they just basically turned it back on her.
Wow. So you were working within another practice.
Another practice. Okay. And I pretty much did her surgery for free. Like I didn't have practice. She didn't get billed for it or what have you. It's just because I said that I would do it.
Gotcha. And you kept your word.
I kept my word. Mm-hmm. And so she was, this was in the summer of 2022. Mm-hmm. And, she flew in with her husband. I performed surgery on her, and it was so touch and go. I don't want to tell too much of her story, but she had a complication in surgery where it caused a bleeding issue. Mm-hmm. It's nothing to my control or what have you, but there are things that can happen in the body in her particular syndrome called DIC. Mm-hmm. Where it uses all the clotting factors. So it was like I could not stop her uterus from bleeding. After I removed all these fibroids, I could not stop her from bleeding. I'm in there hours, and she's losing a lot of blood. And, God was just like, look, you can't do this to this lady. Like, you just cannot. So I struggled. And then I just said, I got it down to where I was like, at least I was comfortable for it. And then I put a drain on my belly so it can, continue to ooze. But at the same token, try to save her uterus. And I kid you not, that entire week she was in the hospital for 3 days. I had that drain in there and it was pouring to the point where I'm just watching her like, you got.
And she's getting transfusions at the same time?
And everything. And I was just like, I'm not going to take her uterus. I'm just going to just trust in the process. I'm going to trust in God. And
in the process.
Thing I'm supposed to do. And I'm just going to give her an opportunity to uterus. And then after about day 3, it started to slow down. The drain started to slow down. I discharged her from the hospital, and I would just go to her house to the place where she was staying, and I would just check on her and just talk to her and check on her. So after a week of that, I felt comfortable enough to remove the drain. Drain. And that was, I ain't hear nothing else from her until somebody told me like,
well, no, she was married because she was like, my husband's coming.
Yeah, her husband, cool dude, cool brother. Muslim couple, like they was super cool. I was like, ain't this something? Like she was on there with a little happy little self, looking with the bone, like, hey, that little guy over there, I didn't do it all. God did something, but horrible fibroids, but I stuck with it and saved her uterus, and lo and behold, like God bless.
But you know what, God, listen, she's 38 weeks, and again, we're gonna do a video sharing her story. But here's the thing, I believe, when you do the work when nobody's watching, right? You do the work because
And that's
It is just, it's your,
Pearl's from Canada. She got an amazing story too. That's
oh,
my
Pearl,
patient.
I can't wait to hear your story. You better DM me, Pearl.
Yeah,
DM me, Pearl, so we can get on.
Absolutely dope. Like one of my international patients, like super dope.
And you know, I spoke to the other international
I did.
patient. She got her kit. She got her prevention kit before she went
Dope.
back to the Netherlands. No, Finland.
Finland.
She was in Chicago at her brother's. She ordered her kit. She's like, Coach Gessie, I need to start working now right away. She ordered her kit before I leave, I want it in my hands. And yeah, it was phenomenal. Cause she was like, can you WhatsApp me? She says, listen, I'm reaching out right now. She says, and she was crying too, because she was like, oh my God, I learned about Dr. P through you. I started crying because I was like, sometimes you have those days. I know you know these days, Dr. P, you feel like, is it working? Is all this work I'm doing, is it working? Like, is anybody listening? Is it like sometimes you have those days. I was having one of those days. She had me just crying like, keep going, Coach Gessie, keep going. Oh my goodness. All right.
I got so many stories. Like I actually one of my patients is in here. It's like I'm just hiring her as my social media manager.
Oh, all right.
Now, I take over that and like tell some of these stories because I've been, oh my God, this is my child. Hey.
Hi.
Hey.
Surgeon in the making. Hello.
Period.
Are you done?
No. If anybody has questions for me, I'm a little bit more interesting.
She might be right.
Close one. Smell. Thank you.
I love it. She might be right though.
Yeah.
But so
Wonderful.
so Ariel, she's one of my patients as well too. So she's going to be taking.
Which one?
They said, hey Ariel, Nicole.
Let me see. I'm looking. She must be further up. Oh no, I see. Wow, I see. Oh, hey,
Yeah.
Hey, it's me. The one that says, "Hey, it's me."
Just say hey with the exclamation point.
All right, DM me, Ariel, because I can't find you right now.
But
okay, next question.
Telling these stories, so I'm far behind, like I said, but I got so many like stories and pictures and videos.
I know, that's what I'm saying. She needs to DM me because she and I gonna be working together.
She gonna start with her own story was like absolutely crazy.
Phenomenal.
Surgery was crazy. So she's gonna start with her own. She was like, you ain't like, don't post nothing else about me. Like I got my own videos and stuff.
Excellent.
Have at it, mama. You go right ahead.
Excellent. We love to hear it because this is the thing. The reason we have to share the stories is because when you live and move in a broken system, right? Mm-hmm. A system that tells you literally none of this is possible. Okay. That's what the system says. Everywhere you turn, that is what the system says, right? It's like the revolution has to happen from the bottom up. It has to happen from the people up because the system is literally needs to be disrupted. And that's what we're doing. That's one story at a time. It's catching fire, opening people's eyes, showing them possibility, right? That's what we're doing. All right, let me make
it and made it popular, man. I was like, listen, I hear so much. It's just so disheartening.
Wait, what did you just say? I didn't hear what you just said. What you just
said? It's just like, this is the type of stuff we should share and be talking about and making it popular because fibroids are such a prevalent and prominent
large scale health.
I promise you, more people know about me in other parts of this country than in my actual city. It's people that like are in my own city
backyard
that are doing like all of these crazy surgeries and stuff or going to places don't even know I exist. And I have people literally driving from Florida, drove from Florida today to like come in here to see what
it be like that. Jesus said it. He said a prophet is without honor in his own home. That's how it happens.
It's disheartening.
It is. That's what I said to. What did I just say a little while ago? I said I forgot her name. My sister from Finland. She hit me on one of them days. I was like,
Kanya.
What is it?
Kanya.
Avia.
Katya.
Yeah.
Yes.
Katya. Oh,
Yeah.
Katya. Katya. Yes.
Yeah.
Yes. She hit me on one of them days. I promise. She had me sobbing. She was sobbing.
We're about to, like, she did this whole video. Like, she wrote me the most amazing letter that I have, like, from a patient I've ever had. It's been like, I want to do something with it. Like, I want to say something about it. Like, it was the most amazing thing in the world. I have to, like, say something. I'm gonna figure out how I'm gonna do it, but like, her story was like super, super touching, and she wrote this dope letter that I want, like, everybody to hear. Super dope.
You know, I'm with you. All right, so let's see if we answered all the questions. Oh my God, it's already 9 o'clock. So I think I think that, you know, at the end of the day, because I want people to remember the key things, right? So number one is that hysterectomy is not the only option for fibroid disease, advanced fibroid disease.
Absolutely.
It's not the only option, and definitely not if you have to have a hysterectomy. You don't have to even be opened up to have a hysterectomy. It can be done laparoscopically. If you have advanced fibroid disease, most people are going to recommend being opened up vertically and vertically and removing your uterus, meaning they're going to recommend a hysterectomy because they don't have the comfort or the skill level, right? That I need that to be ringing in our ears, right? So that it helps us to say, okay, wait a minute, ask the right questions of the surgeon to see. And I remember we had this conversation before. We were like, you know, what were some of the questions that you asked to find out if really the issue is, well, number one, you need a new baseline. The baseline is a hysterectomy is not my only option. Like, let that be your new baseline. Your new baseline needs to be hysterectomy is not my only option for advanced fibroid disease. And then hysterectomy or any surgery with a vertical incision,
Right.
okay, is not my only option.
Right.
All right. So I don't need to have a hysterectomy because I have advanced fibroid disease. I don't have to have a vertical incision if I have advanced fibroid disease.
I would even say this clearly, and this is me making a very bold statement. For benign gynecology, meaning non-cancerous gynecologic surgery, a vertical incision is never indicated.
Wow.
Now, mind you, I said benign. So cancer is a different story.
Yes.
But for benign gynecology, that goes for C-sections, that goes for myomectomies, that goes for hysterectomies. A vertical incision is never
endometriosis.
It's never
adenomyosis.
Never needed.
I'm saying it because people are asking that. I'm saying because I want to hear it said. You know what I mean?
I'm your hype man. Never. So, and then with that being said, you know, hysterectomy does have some bad connotations as it should because of the trauma that women, especially Black women, have gone through over centuries. So it definitely has its negative connotations. However, when done appropriately and correctly, it is a viable and good option for some women. And I know the fear of having it with the word is never to get it, but some of you guys it is the best option for you.
Let's talk about that. What's the best? What scenario would a hysterectomy be the best option?
So if you have advanced fibroid disease and you have absolutely no intention of childbearing, hysterectomy is your best option. Because putting your body, everything in life is a risk versus benefit.
Risk versus reward.
The reason we go to the grocery store and get in our cars is because going to get the groceries and coming to eat in your house far outweighs the 0.001% chance that you don't make it to the grocery store.
Right, because of a car accident or whatever.
Turned into a 10% risk that you don't make it to the grocery store, then you would think twice before going to the grocery store. You would do something else. It's the exact same thing. When you are going in for surgery, in this particular case, hysterectomy, you are saying that the benefit of preserving your uterus has to outweigh the risk. So if you're going in with advanced fibroid disease, the benefit of preserving your uterus for having a child outweighs the risk of the bleeding, infection, pain, recovery, all this, the benefit of having that. But if you're going in for a myomectomy and you have absolutely no desire to have a child, it's literally for you to keep your uterus. The risk of bleeding, infection, pain, recovery, or what have
Scarring, all
those
the
things
scarring
have
from all
to
the
outweigh
incisions.
the benefit of just saying, hey, I got my uterus. The benefit is not there. So don't put your body through a risk without a benefit. Everything in life is risk versus benefit. You have to look at it that way. And for those women, you have to ask yourself, every time I start a consultation, I say, what is your goal? And a lot of women say, my goal is to get rid of my fibroids. That's not a goal. What is your goal? The two goals you have is A, I want to end my pain, suffering, bleeding. There's nothing in life that I want to do but to improve my quality of life. That's my number one goal. The other one is I want to have a baby more than anything. I'll pay $20, $30, $40, $50,000. I don't care what it is. I'll run through a brick wall. I'll do whatever it takes. I want to have a child. You have to answer one of those questions. If it's A, you want to deal with the symptoms and you have no desire or very little desire to have a child and you're not going to pay for that, then you have to consider a hysterectomy. You at least have to consider it. Maybe it may not be the answer, but at least consider it if that's the thing. So
I love that answer. And I want to add to it that
and so Q is that you got to shout her out because she is the woman that you are posting when you put that on there for us. Ooh. Is that Q? No, that's Lady Q. It's a different Q.
Which Q?
So it's
which one? Read them.
So because I know it's Q. I don't know if she changed it, but it's Q. So Q is the patient that you actually put on for like to advertise us talking today. When you pointed up, and like that
was her. Okay.
Yeah, it's Q. I'm not sure if that's the same Q. I believe.
Okay, well, let us know if it's you, Q.
But it is. Her handle has Q in it, but I'm not sure.
Okay, well, let us know if it's you, Q. Your story, if it was shared.
Different Q.
Okay.
My bad.
So going back to key thing though, a hysterectomy, not including removing your ovaries, is an important distinction. Okay. Right? Because removing your ovaries can cause a host of other issues, health issues, hormonal imbalance that can lead everything from depression, suicide, cardiovascular issues, osteoporosis, cancer, like in terms of the hormonal imbalance connected to removing your ovaries, right? It's important to understand that when you're removing the uterus itself, but not removing the hormone regulation system, right, through the ovaries, that is a major distinction.
Absolutely.
I had a hysterectomy, all right, because I've been through all these surgeries, that's when all of my advocacy and all of that, because I went through it before I knew anything. So I had a hysterectomy in 2015 and they left my ovaries. And I know my case is not common. Okay.
It should have.
It's not common. It should have been. But guess what? I had a UFE and I know there are people who we're just not going to dig into the UFE today as long because it'll take us too long. But key thing, they left my ovaries. They removed the uterus. And at 44, I was in full-blown menopause. Okay.
They left your ovaries?
They left my ovaries.
They should have. Like, so you said you just...
I still went into full-blown menopause. And all they could say to me is, well, we don't know what happened in that. Maybe it was connected to the UFE where your blood flow and everything changed and it disrupted.
Absolutely.
Right? Because that was literally my ovaries were there. So I have severe osteoporosis. Okay. I have to take bone density injections. All right. Like I'm going to do a post where you're going to see what you see and what you don't see. And it's going to name all, from head to toe, all of the chronic conditions I navigate because of what my body has been through and why it drives me every day to do the work that I do, right? But the key thing is that estrogen is, and people, estrogen is bad when it's dominant, not when it's balanced. When it's balanced, it's responsible for your healthy hormones. It's responsible for your figure, your body. It's responsible for your bone health. It's responsible for your cardiovascular health. It's connected to your libido. It's connected to your sexual pleasure. It's connected to a lot of things, right? But when it's deficient or it's too high, that's where you have trouble, right? So again, it's important to understand if you are going to do a hysterectomy, please don't, again, UFE is too many things, too many things we have to say about that. But if in those cases where, because what he said, and that's what I want to get to, is that it is a lot of risk to go through a myomectomy, right? Meaning being opened up, depending if you have advanced, that means you're talking about a much more significant surgery, right? It is more risk. And if you're not trying to have children, and, again, best case scenario, no surgery. Best case scenario. That's why we preach intervention early in terms of your, being healthier, helping your body to prevent conditions by having a healthier profile overall. That's why we have things like our prevention protocols and all of that. Ideally, that's the best case scenario, to keep all the parts, to not have anything cut out, right? But that is not the scenario of a lot of people. And so what we want to make sure is you have all the information and all the options in your frame of reference. Because like we started this conversation, if you don't know it exists, you don't even know it's a possibility for you, right? And that's why we wanted to drive home all of these points. I'm good. Do you have anything? Oh, somebody wanted to know. So we talk about a lot of these fibroid surgeries.
Oh, so cute. So if you see her, it's oh so cute. It's not Lady Q. It's oh so cute. It's her.
Oh, so
Oh,
cute.
so cute.
Okay. Can you send me her information so I can reach out to her? Like later, so I can tag her and just not tag her, just reach out and just tell her, encourage her. That's all. Because we're all in this together. Okay. So
but I'll send it to you.
Okay. Endometriosis. We don't talk about this condition, adenomyosis, and surgeries. Do you perform surgeries for these conditions?
I do. So a lot of people ask about
the excision surgery for endometriosis.
But adeno in particular. But endometriosis. So endometriosis is a condition, just quickly, that when the lining of the uterus I got diagnosed. All right. When the lining of the uterus grows into the actual pelvic abdomen,
and
so like when these,
not just the abdomen, because it can be found. It can go to the lungs. It can go to the brain. It can travel in many. That's why it's called
it's very painful because those implants respond to hormones. They respond to your ovaries' normal production of estrogen, progesterone. When they're concentrated in the place that they're supposed to be, it should not be extremely painful. But when they're responsive in other places, they can be extremely painful. So the thing that is sometimes confusing is like it's always a surgical intervention that can fix it. It's not true. Sometimes you can actually go in and look at a patient with bad endo and you can't really see a lot of implants. You can't really, there's not a lot to remove, or what we call peritoneal stripping. So peritoneum is if you think about the paint inside your room of your house, inside of your abdomen, it's the paint on the inside of your abdominal
layer. It's the inner lining
tissue, or the inner lining of it. So that's where it likes to plant into those spots. And so with that being said, you can remove some of the paint that has those lesions in them, but sometimes you can't even see those lesions in the paint. So if you cannot, medications are vital. Well, medications are going to be vital regardless. Whether you can remove some of those lesions or strip some of the paint, it helps with the treatment, but you're not going to be able to remove it all. So when you do that, if you do not suppress the ovaries, which actually feed those lesions, they're going to continue to be a problem over time. So you have to do the surgery.
That causes other issues. It's a terrible inflammatory.
It's a very difficult inflammatory process to deal with. The only, I guess, silver lining is that the ovaries are continuing to decline, and at a certain point start to do this. So with time, endometriosis will get better.
But what about fertility? Right. It's a major factor in infertility.
Multitudes of different things that come into it, but hormone suppression is a big thing. Adenomyosis is when that same thing, when you have the lining actually growing into the muscle of the uterus. So when the lining grows into the muscle of the uterus, this is a very, 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 very difficult thing to deal with, because
so it's like a cousin between fibroids and endometriosis.
Absolutely. But the difference is with fibroids are completely different.
Like it's different tissue. It's muscle tissue. Well, right. It's muscle tissue that is similar to what the uterus is made of, right? No.
It's smooth muscle tissue, but it's very distinctly different.
Okay, so it's smooth muscle tissue, but it's different from the tissue that the uterus.
Very different. So you can see the levels of demarcation, meaning that
you can identify them, you can separate them
within a bit. I use the example like a pea or a marble or orange or a golf ball in a.
It has its own structure. It has its own enclosure. It has its own.
Shell it out. You can shell it out. You can remove it, and you are left with the steak because you've removed that mass out, and now you could just repair the steak. Whereas adenomyosis is not like that. It's so intimately intertwined into the muscle. It's almost like the muscle. So like you're literally cutting out muscle, almost like a cancer, but it's not malignant.
Right.
It's benign cancer, if you will, where it's like intimately intertwined into the muscle of the uterus. So removing those lesions becomes extremely difficult to the point where you really cannot remove them. And it's very difficult for treatment. So it is one of those things where you just try to deal with the symptom or manage the symptoms for long enough for you to utilize your uterus for whatever you're trying to do, have a child. And once you do that, at least consider, if it's really, really bad, impacting your quality of life, you have to at least put hysterectomy on the table. Not to say that's your only option, but it at least has to be considered, just because from a treatment standpoint, yes, you can Accessa is not FDA regulated for adenomyosis, but there have been some positive studies that show that it can improve some if you do ablate or treat those lesions, as well as the
sonogram. You can do it through with Accessa. So with Accessa, it's done through sonogram, right?
Yeah, approved. Like I've done it, and it has helped people, but again, it's not something that's completely indicated. They've also have some studies that say that UFE can help with adenomyosis. I don't believe that as much, but they do. I can't fault the studies, right? So, or actually going in there to remove adenomyosis out the tissue is going to cause more damage than good. It's not because like a fiber.
It's so weaved into the tissue.
You're going to remove a lot of uterine tissue when you do that. So it's one of those diagnoses that it's extremely difficult. It does not have a true treatment. It doesn't. You have many things that may improve it.
Yeah. So like even hormone suppression can be done naturally through
true treatment. The only definitive treatment for adenomyosis is hysterectomy. It is. If you want to get rid of the pain and everything, that's the only thing that you can definitively say it will eliminate that. But again,
but there are other ways to manage it, is what you're saying.
For sure.
All right. Well, that started a whole new conversation, but
I bet.
Do you have any final things? Any final notes and things?
No, just be smart, people. Know your options.
Yep.
It's you have to go into your doctors and actually be very proactive. You have to be knowledgeable. You have to arm yourself with knowledge. You have to ask them.
I know what we said. So if the doctor says to you, so baseline, remember those two baselines we said?
Mhm.
If the doctor says to you that hysterectomy is your only option, that means that that's not a doctor. That you need to find another one.
Not-
So that's that. So that's number one. If that is the way, the course, right? So you have to find someone who speaks the same language. The same language is long-term healing and health, preservation of your overall quality of life, right?
Never tell
And
anybody that hysterectomy is their only option.
Yep.
It may be the best option for them, but there's
and if someone says vertical incision is your only option, that is again someone who is indicated that they're not skilled enough and not comfortable enough.
correct.
Okay.
Never your only option.
Yeah.
For me, it's not a good option ever.
Yeah. Well, I like that. I like that as a, so I was I was on a webinar talking about Black maternal health in the case of Jessica Petway.
Yeah.
And I know, and Crystal Armstrong. And one of the things I said to them, I said, one of the ways that you help to separate out the physicians that, that you should even consider is asking the question, given the fact that the Black maternal mortality crisis, and we know that that there is medical bias and systemic racism in the medical world, how can racism show up in this case? How are you prepared? Like, what plan have you prepared, or how can we create a plan to ensure that we account for it and prepare for it? And if they're like, what are you talking about? that's a goodbye. That is not your doctor. Okay.
Right.
Because if they say, absolutely, so here are the things that we do to make sure that we're able to identify it and to prevent and intervene and all of those things, and then they go through that with you, at least they're on the playing field of possibility. Right.
Absolutely.
So use those two things. Are vertical incisions necessary for fibroid surgeries?
No.
Right. And before that, is hysterectomy the only option?
If you have a vertical incision for a surgery and you choose to not have another scar and you want to utilize your vertical incision for this follow-up surgery,
I don't know if that's even still good though.
I'm
gonna tell you why. So I'm gonna tell you why I don't think that again, this is me personally.
I give you, but I'm just gonna say as an option, I at least give women that option. That's the only time I think I may have done that less than 4 or 5 times.
Because they don't want they don't want another surgery. They don't want another. I get it.
I can't erase what you've done in the past, but I can.
Right.
Revisions, meticulously put things back together again to reduce adhesions, vertical incisions. Yes, they increase those things. However, if it is done appropriately and someone has a meticulous approach to surgery, it can be done safely. So that's the only way that I would say it makes sense. Other than that, it never makes sense. But go ahead. I'm sorry.
No, I get it. And what I was saying is that is another scar. You're right. But if I had
yeah, you've been through it. So you are
10 days after a myomectomy that was a vertical incision myomectomy.
That was
open
a mistake there.
10 days later, the first surgery, anyway. But again, knowing now all the things, I had no idea the things that I could do to intervene in my own health. And that's why, I work so hard now. I think that we've covered everything. I'm looking forward to our next conversation. I appreciate you, brother. I know it's been a long day. You're worth every bit of every moment and anything that is necessary. You know it, right? And I appreciate you that, again, doing this work together of helping people who have, these advanced conditions, and then people who just need to know, okay, what they can do post-op. There've been people who told me, okay, look, Dr. P told me to contact you. I had the surgery and, we're working on that. We're working on their post-op plan to to prevent surgical complications as much as their body can through their power, and to help them to have a healthier life afterwards. So that's what it's about, an integrative approach, and doing what you can do in your power, getting educated about everything that's available to you, and then also, making sure that the people who you are entrusting your lives to are worthy of it.
Right.
Okay. Thank you, sir.
Absolutely. Thank you for having me. God bless everybody.
God bless everybody.
Thanks.
Bye. All right, folks. Thank you so much for your time. I appreciate you spending the time with us today, and I hope that you have learned more than you knew before you started this conversation, and that you know that you are not alone. You're not alone, and that if you need some support in helping make the right decision for you, you need support in finding the right physician for you. You need support in knowing what you can do to help proactively end your suffering, or help. You've had fibroid surgery and you need to know what you can do to help your body prevent your body from creating more or from having future surgical complications. Listen, we are here for you. So please go to thedetoxnow.com, thedetoxnow.com, take our free quiz, book a free consult, or our link. We also have a link to Dr. P's consultation on that page as well at thedetoxnow.com if you just click on the consult page. And also, we're here. We have support systems, as well as we'll recommend things that we've seen be really successful for other people. And we created to support you on your journey of healing. We love you. Thank you so much. Please know that you're not alone. And remember, listen to this and share it with others, because the revolution is going to be started by us. We've got the power. We can make the decisions when we have the information. Thank you for being here today with us. Detox Living. I'm your host, Coach Gessie. Good night.